holidays, everyone. I'm your host, Jennifer Williams, and I'm so happy to be here with you today. We are happy to welcome Dr. Anila Faizan, Medical Director of the EHM Hospitalists at Cooperman Barnabas Medical Center. We know the holidays can be really stressful, so we are here with some tips to help you have a healthy and stress-free season. So if you have a question for Dr. Faizan, leave us a comment below, and please help me welcome Dr. Faizan.
Thank you so much for having me.
We're so happy to have you today, and for everyone out there, I've gotten to spend the last few weeks with Dr. Faizan preparing for this, and I'm so excited today because she has such a wealth of knowledge, and she's truly such a wonderful doctor. So we're so glad to have you.
Thank you, Jen. Pleasure is all mine.
Yeah, so we're so excited. So let's just jump right in. So tell us a little bit about yourself and the work here you do at CBMC.
So my name is Anila Faizan. I'm the medical director for the hospitalist program at Cooperman Barnabas. I finished my residency in 2010 from Richmond University, Staten Island. And I have been working at Cooperman Barnabas for a little over 15 years now.
Oh my, you would never believe it.
So I would like to take this opportunity to explain the role of the hospitalists. So hospitalists are the internists who provide the 24/7 care to patients admitted in the hospital. And the role of the hospitalist enables primary care physicians to dedicate 100% of their clinical time to the patients in outpatient settings.
That's so helpful. I think that's a term that people don't always understand, or they're like, who's the doctor that's coming in my room? There's all different people, so that's really helpful. So thanks for giving us a little more information about that. So let's get into our holiday questions. We know, at this time of year, people are just constantly on the go, and they tend to ignore any signs and symptoms that they may be something wrong with their health. Why is it so important for people to seek medical attention if they aren't feeling well?
Thank you so much for this question, because this is extremely important to seek the medical help. As soon as you're having some signs and symptoms, you know your baseline and you know what is so different. As a hospitalist, I can tell you that in post-holiday phase, we do see the patients who present with worsening of their conditions because they did not seek the medical attention in time. They were just hanging on for a few more days for the holidays to be over. And in good intention, they don't want to ruin the plans for themselves or their families or their friends, so they just hang on there. So I would tell you it is extremely important, for the critical symptoms like chest pain. It's a very, very common scenario when the patients say that, it just felt like heartburn, and they thought that it is something that they ate, and they didn't seek the help and just waited for the holidays to be over, and now by the time you're presenting in the hospital, the care is delayed. So in addition to the critical signs and symptoms, it's also important to make sure that you are listening to your body. When something different is going on, your body is telling you, and you know your baseline. You know what is different for you. Just to give you an example, sometimes unexplained fatigue or tiredness could be the symptom of a serious health condition. So whatever is not explainable and whatever is different for you, seek immediate medical help.
Yeah, I think that's so important too. You know yourself. Even if it's just, it's fine, it's nothing. But, just before it turns into something, always seek that attention. And getting together is the best part of this time of year, but it can also be very stressful. So what are some tips you have for us to reduce that stress?
So yes, holidays are supposed to be relaxed and fun time, but in many situations we see that we are very overwhelmed, we are stressed out. And what is causing me stress could be different than what is causing you stress. So in order to come up with the strategies how to deal with the stress, we need to figure out what is causing us the stress to begin with. So the main reasons why people are so stressed out during holidays is that they're overcommitted. They have said yes to so many things that are not even that important for them. They have a long to-do list, and they have so much expectations from themselves and from others as well in some situations. So what I want us to remember is that what is important for our loved ones? What are they going to remember? It's not going to be the most expensive gift that you bought for them or the most delicious meal that you cooked for them. It's going to be the way you treated them. So to treat others nicely and positively, you need to be in your best state of health and mind. And how can you do that? I mean, I will give you the example of sleep, right? And during
Yeah.
holidays times especially,
Yeah.
people stay up till late
Mhm.
to have fun. Then what happens next morning? You are irritable, you are grumpy, and we're not at at the best of our
We're
moods or
not
so.
living our best
So,
selves.
yeah. So stick to your sleep routine. Keep yourself well hydrated. Do not compromise on your nutrition or exercise routine. It goes to self-love, and it's not being mean that you're focusing on yourself. It's doing your body, yourself a favor, and hence doing good for the others.
Yeah.
So focus on your health.
I love that. We can be our best selves first and foremost,
yes.
and then we can.
Oh, yes.
Then we're able to give more. Okay, so this is my hard-hitting question of the day. So, we all have like our favorite meal, our holiday snack is this time of year. So what is yours, and what tips do you have to help keep things in moderation? Should we cutting out our favorite treats? Is it okay to indulge? What do you have for us?
My friends, my family know that I have a sweet tooth. I do have the craving for the sweet stuff. But the way I deal with that is that I love fruits. So always I take my time to prep the fruit salad.
Okay.
And I will include all the seasonal fruit in it with the dates and prunes for the fiber and elements. So whenever I have the desire to eat something sweet, that fruit salad is ready in my refrigerator for me. So
fruit salad, everyone. I don't know,
but I do have many others as well.
Okay, so if you're really, really going for it,
Right.
that one thing that you love to have this time of year, what is it?
So I love pistachio milk cake.
Oh.
So it's like cake with a lot of milk in it,
Okay.
a lot of pistachio too.
Okay, so
Full of calories.
oh, that's okay. You can take just a little, right?
Yeah.
Balance that out with that fruit salad.
And moderation is the key, right?
Yeah.
The balance is the beauty of life. So eat in moderation. I mean, I would suggest that go by 80-20 rule. Like 80% of the time you are eating the nutritious food, but you are allowing yourself to go for the meal or for the dessert that you really like, especially during the holiday time.
Okay.
You don't want to be like completely stop yourself from doing that, because then you're gonna have strong cravings, and then you're gonna really crash.
Too much.
So,
And then you'll
it's gonna be too much.
You'll literally have your hand in the cookie jar.
Oh, yes.
Caught with your hand. So, you touched on this a little bit before, but mindfulness is so important. How do you practice being mindful? What advice do you have for us to practice being more mindful?
So mindfulness is basically being there in the present moment, without the regrets of the past or without getting too much concerned what's going to happen in future. So present moment is all that we have. We all know that there are various techniques available. There are different meditation techniques, and there are some breathing exercises. All that works. But one thing that is very relatable for me is that practicing gratefulness really helps me stay focused and present. What I have seen is that an ungrateful person cannot be mindful. You need to acknowledge and appreciate the blessings that you have. And how do we do that? It's not just about counting your blessings. The way we reflect on it is that we share it with others. Like if financially you are doing good, you share the resources with the people who are less privileged. If you are knowledgeable, spread the knowledge. So whatever it is that you have, spread it and share it with others. So being mindful of what you have helps you stay very, very focused. And I would say that even in worst possible circumstances, we do have a lot to be thankful for.
It is. I love that too. I keep a grateful journal. So even just one day, even every day, it's writing one thing down that you're really grateful for that day, or if you're feeling down about your body or whatever, how does your body help you, and it kind of helps you refocus, and I love that. I love saying that, and paying it forward, I think, is so important too. And in doing that, you're talking about being connected with family and friends. Sometimes during the holidays we can't all be together in the same place. So why is it so important to have these connections, and what advice do you have to help stay connected during the holidays?
Right. So if you are not able to meet your loved ones and not able to be there in person with them, use technology. Technology is a tool for us. We should not be consumed by technology. Rather, we should be using it for the deep, meaningful connections. Do the FaceTime, like the video calls. For your loved one, if they are somewhere else, maybe send them a personalized message, maybe send them a gift. It shows them that you care about them.
Mm-hmm.
So social media, we see that it is being used for so many, wrong purposes, right?
Mm-hmm.
People just taking their happy pictures and posting it. The other people are looking at it and they're not happy with their own lives because they see how happy the other people are. While the people who are posting it, they're seeking validation, likes, and all that. So instead of that use of technology, using it as a tool for the deep, meaningful connections is the key.
Yeah, I love that. And on the other end of this things, people do get to go traveling for the holidays. So whether we're going long distance by car or getting on an airplane, what tips do you have for holiday travel?
Oh, a lot of travel happens during
this
season.
My goodness, yes.
Oh yes. So if you are traveling outside US, I highly recommend that you do your search on the place where you're going. If there is any need for any vaccinations for you, make sure that you are up to date with that. If you are on any standing medications, make sure that you take enough refill to last your trip. And do take over-the-counter medications that work best for you. Everybody has their favorite when it comes to the over-the-counter stuff. So pack them. If you are driving long distances, make sure to take frequent breaks to stretch out. Keep yourself very, very well hydrated. And if you are flying and your flight is long, make sure that you're not sitting for a prolonged period of time, that you're moving around. Otherwise, our risk of developing the blood clot goes up. So move around, keep yourself hydrated, and also make sure that you pack healthy snacks. Because when we don't have healthy choices, what we fall for. Whatever is easily available.
Whatever's right there. Especially, it's so easy now. There's chocolates everywhere and cookies and sweets, and so it's, again, practicing that balance of life. And we have a really great blog that we're going to share that link for you about some tips when you're on the airplane and some exercises you can do and things like that. So look out for that in the comments there. And we always love to give, on this program particularly, we love to give friendly reminders to get your annual checkup. So tell everyone, make your elevator pitch. Why is this so important?
Remember that prevention is better than cure. I just explained you the role of the hospitalist. What do we do, right? We see the admitted patients in the hospital. And it's not uncommon for us to see those patients who never saw a primary care physician, and they end up something like really drastic, and they have those regrets that only if I would have seen somebody in time, right, a healthcare professional in time, and have got my screening done in time. So you don't want to have regrets. There are a few things that are beyond our control, and there are some things that are under our influence and under our control. So going for the annual checkup is under our control. Do your best to make sure that you are preventing the illnesses that can be prevented. Seek the medical help.
Go see your doctor, and we will. We have a comment or a question from our live. I was telling Liz, this is amazing. Okay, we're holding our cue card here. So how important is it to balance work and holiday preparing? So what are kind of some tips you have to kind of balance that? Thank you for whoever sent that in.
So balance is the key. As we were talking about earlier, balance is the beauty of life. Yes, when we are at work, 100% of our time is dedicated to work. Similarly, in your personal life, you have priorities. We should know our priorities. And yes, families come first, right? You have to make sure that you are giving them the time and are having the meaningful time that you're spending with them. So organizing and structuring your week, like if we're not talking about the day, maybe the week, structure it. See what is most meaningful. Make a list of the important things for you. And then accordingly design your workflow and your personal life.
For me personally, sometimes I think we tend to look at things really big picture, and like you said, like kind of take the week and break it down and find those moments to kind of find that balance. Thank you again. Great question.
And at this moment, I do want to also acknowledge, I know that not everybody has the flexibility or freedom to do so. And they are, they are supposed to work for X number of hours to make the ends meet. So I'm not ignoring, that aspect. But then after your work, whatever time you have available, Use it for the deep, meaningful interactions with your family, and just be yourself. You don't have to do the things in a certain way because everybody else is doing. See what makes sense to you and what makes sense to your loved ones.
Yes, that's so important. That's great advice. Okay, so we are heading into 2025, and we've been talking a lot here in our department about thriving in 2025. So what are 3 healthy habits you think that we should, practice and take with us as we go into a new year?
Absolutely. So I would say that do not wait for the new year if you are considering to make a change in your lifestyle or in your routine. Don't wait for the new year, because if we think about it, what is so new about the new year? Every day when we wake up in our bed, this is a new day for us. This is the whole new opportunity to design your day, your life the way you want to do it. And you asked for the 3 advices.
Yeah.
So I will put them into 3 different buckets.
Okay.
Like diet, exercise, overall well-being. So when it comes to diet, I do not recommend any specific sort of diet. Like some people take out proteins completely or carbs completely, and then the studies have shown that after a certain period of time, you fall back into your previous diet habits, because these are not natural habits for the diet. So eat in moderation. That is the key. And to eat in moderation, the tip that I have is that, or what I practice also is that I drink a glass of water in the beginning of the meal. So, my stomach is filled, 1/3 is filled.
A little trick.
So then, it helps you eat in moderation. And again, I want to clarify, I'm just talking in general. There are certain health conditions when you need to be on certain kind of diet. Like, for example, for heart failure patients, you cannot have, that much salt in your diet. So if you have a specific health condition, follow the advice of your healthcare profession. And the second bucket is the exercise. So, sitting is new smoking. If you come to know about the side effects associated with prolonged sitting, I mean, you will be amazed. There are tons of them. You name it, and the sitting causes that. Like, for example, the risk of the heart disease goes up, type 2 diabetes, metabolic syndrome, back pain, anxiety, depression, certain sorts of cancer even. So it can be compared to the side effects of smoking now. So we are in this sitting pandemic. So make sure that you are standing up, walking around, and add some exercise routine to your daily life. And I promise you, if you add it, you are not going to regret it. Do it for a month, it will become the habit, and then you are going to thank yourself that that you're doing it. Your overall sense of well-being, it just gets so much better.
Absolutely.
Right.
I like that, making it a habit too. Then after you do something for a certain amount of time, it just becomes.
Oh yes. And then overall well-being, gratefulness. A grateful person is a happy person. If you want to be happy in your life, practice gratefulness.
It's so important, and you've shared so much wonderful information with us today. I feel ready to go into the holiday season now. Is there anything else you want to tell us this, as we close out here today?
I would say that we need to redefine the purpose of our life. It's very important to stay connected and stay true to what makes most sense for you. What is it that you want to do in your life? What you want to achieve. So, and your every day should take you a step closer to your goal. So redefine the purpose. Don't live the life like on autopilot. That is just happening. The things are happening to you rather than you doing the stuff. So take the control of your life, define your purpose, and every day make sure that you're doing something towards that goal.
I love that. I feel really great. I have some things that I know I want to go do now and work on, and I'm grateful to be able to sit here with you today. So thank you so much for coming. So everyone out there, we as we said, don't put off going to your doctors if you're not feeling well. If you haven't visited your primary care doctor in a while, please go make that appointment. And if you're looking for a doctor or want to make an appointment, please visit our website, and we have our whole list of doctors available for you. And on behalf of everyone at Cooperman Barnabas Medical Center, we wish you and your families a very happy holidays and a very happy new year. So we'll see you in 2025. Take care, everybody. It's a very dramatic sound.